So for next respiratory complications you can see in babies, we'll get to talk about what is known as a transient tachypnea of the newborn. Transient tachypnea of the newborn. So for this transient tachypnea of the newborn, it's just a mild respiratory condition. When they say something is transient, it's passing. It will come and go. All right. So it's seen in newborn, especially those born via cesarean section or without labor. So it's caused by delayed clearance of the fetal lung fluids. Now that push that the mother is pushing is also helping the baby clearing any fluid in their lungs. So if you just give birth to a baby through cesarean section without any pushing, or the baby just came out without any prolonged labor, all right, it leads to not really prolonged labor, without any tangible amount of labor, it leads to like accumulation of fluid in the lungs of the baby. So the baby is out and is having short breaths. So why it happens is that a baby's lungs are filled with fluid. Normally this fluid is absorbed during labor and delivery. Okay, the push helps. So if you guys bypass that, let me say the cesarean delivery, the baby was just brought out without any stress, or sometimes the baby is premature, right? Maybe the mother had diabetes or asthma, maybe, okay, and it occurs more in the male sex, okay? It's also a risk factor. Then maybe there was lack of labor before the birth. All of this could cause accumulation left back fluid in the lungs of the baby, and to make the baby find it very difficult to breathe after childbirth. Symptoms is the person is trying to catch the breath, so the breathing is very rapid, okay, and it's short. Grunting, nasal flaring, mild cyanosis, all right, chest retractions. All of these are symptoms of that. So diagnosis is all those chest x-rays, blood tests. Chest x-rays, you want to see what is there. Blood test, basically you want to rule out infections. Pulse oximetry, you want to monitor oxygen levels and all of that. Treatment is oxygen therapy if needed, IV fluids if feeding is difficult, antibiotics only if infections is suspected, and you can now put the person under a special type of oxygen which is called the CPAP. So that's just it for this. Just so you know that it's transient stuff, it's a respiratory issue, but it's mild, usually clears. All right.